Hello, everyone. Welcome back to Let's Talk About Sleep. If you like this video, please click like. Please subscribe. Please ask any questions or comments in the description box below. And as I always say, just a disclaimer, these videos are for educational purposes only. They should not supplant medical decision making with your provider. Okay, so always discuss these things with your provider. Okay, and as I always say, my book, the link to it is in the description box down below. And with that, let's get started. Now, speaking of decision making, what I think I'm going to do is I'm going to start a new video series where I answer questions that have been built up over like the last month or so, let's say, last 1 to 2 months. Okay, so as I always say, please ask questions in the comment section, and I'll get to them. Okay, so I have a couple questions that came up over the last month or so, some really good ones, which we're going to go over today. I'm not going to use the full handle, okay? I'll just use their first name or part of their name, okay? Because, yeah, these comments are public, but I don't want to make them even more public, okay? So yes, I do see them, so please ask away. Some really good questions came up, so let's get started. I have my little printed out sheet here, okay? So Robert asks, thanks for both of these videos. I have 3 questions. 1, he's talking about trazodone. I have found effectiveness really varies based on emotional stress the day of. Yes. So sleep medications in particular, they're not panaceas, right? They're not meant to take care of whatever's going on in your brain and also help you to fall asleep. Now, trazodone does have a component of that, right? It is technically an antidepressant, so it can quiet the mind down and it will help you to fall asleep. But if the anxiety's out of control, or if there's very severe depression, it's not going to do enough. I mean, it certainly can help, but it's not going to do enough. So, you may need either additional medication or increased dose, or definitely to talk to your provider, therapist or a psychiatrist or whoever is prescribing that medication to you. Good question. Number 2, will depression/anxiety symptoms be improved at a lower dose, 50 to 100 milligrams? Could be. So I have had patients tell me that while we're not using it for this reason, that by putting them on, let's say, 50 milligrams of trazodone, that helped them to sleep better, and it quieted their mind down a little bit. And because they're sleeping better and their mind is quieted down at night, they felt less depressed and less anxious the next day. If that happens, that's great, but that's not really the purpose of it. Okay, but it can happen. And yes, 50 to 100 milligrams, I mean, that's a good dose. That's a standard dose. Okay. Number 3, after about 7 weeks of usage during an incredibly stressful time in my life, going off the drug produced a very intense anxiety response. Is this withdrawal from the drug, or more the underlying mental issues being unmasked? Great question. Could be both, right? Not that trazodone is going to cause any kind of addiction, but what can happen is, or physical addiction. What can happen though is if I gave you a sugar pill, Robert, and I said this pill is going to help you to sleep better, it's going to get rid of your anxiety, you're going to feel great, right? And you use it and you believe in it, and you took it for, let's say, a month or so, and then I took it away abruptly. Guess what? You're going to feel a certain level of, I need that pill. It's helping me. Okay, that's kind of a psychological addiction, right? And that can happen with anything, whether it be trazodone or anything else. So it could be a component of that. It could also be the other part you mentioned, where it could be that the underlying stress and anxiety came back. These are great questions. Definitely worth speaking to your provider about. Okay, as I'm going to be saying a lot throughout this video. It could be both. I have a lot of patients, though. I'll tell them, look, if trazodone is working for you and there's no, real underlying issue, let's just, underlying major medical issue that we'd have to worry about, let's just keep it going, if it works. All right, good questions, though. Allison asked, I would just prescribe trazodone 50, Zoloft 100, lamotrigine 50, propranolol 10 milligrams 3 times a day. Want to learn more about what I'll be trying and praying it will help me. Well, Allison, that's great question to ask about the medications you're prescribed. Definitely better to ask the person who prescribed them to you. I can talk about trazodone if you'd like. It definitely seems like there's underlying psychiatric stuff going on here, so you definitely want to make sure that the person who's prescribed these medications, you talk to them about this. The only thing I can really comment on here is that Trazodone and Zoloft, they're both serotonin-based medications, and while it's extremely rare, people can get interactions with the two of them. Okay, so just may want to bring that up. Okay, what can happen in rare cases, and I really haven't seen it, but those two medications together can cause serotonin syndrome. Again, rare, but just be aware of it. Maybe bring it up to whoever prescribed them. That can result in really stiff muscles and high fevers, and if it gets to a very, very severe case, can be very dangerous. So again, not something that really we're super concerned with, but just be aware that it is out there. So you may want to talk to your provider about that. Okay. Good luck to you. Pulowski writes, talking about Trazodone, I personally use between 12.5 to 25 milligrams with the help of a pill cutter as a sleep aid, and from my experience, it's still effective at lower doses. Yes, absolutely. In patients who self-reported say, I'm very sensitive to medications, sure, I'll have them start with a quarter pill, 12.5 milligrams, and work their way up from there. I also use alcohol 4 to 6 hours before bedtime. Typically, Pulowski, what we think with that is one drink, whether it be a beer, whether it be a shot, whether it be a glass of wine. It takes about 2 hours for the body to metabolize it out. So if you have one drink, 6 hours before bed, probably not a big deal. Is the risk of combining Trazodone with alcohol still there for lower doses? And what's the risk besides stronger sedation effect? Well, with any sleep aid, you're right, sedative effect is what we're concerned about with the combination of alcohol plus X, right? But with certain aids, like Ambien, for example, or the benzos, we're really worried about respiratory depression and worsening of sleep apnea, okay? You're not going to get that with Trazodone necessarily, but it's not a good idea to combine these things in any capacity, right? So, again, if you have a glass of wine with dinner at 6 p.m. and take your Trazodone at 11 and go to bed at 11:30, there's probably not any overlap there, so that's safe. But the more alcohol you drink, the closer it is to bedtime. Yes, there's increased risk of sedation. Could that lead to severe respiratory depression? It's possible. I would not recommend it. Okay. Plus, alcohol can disrupt your sleep anyway. All right. So just be aware of that. And then lastly, I'll say, which happens a lot of my patients, there may be some self-medication, right? So if you're drinking alcohol every day and that's helping you to relax, that may be something you want to consider taking care of. The same goes for heart problems. Does a lower dose reduce the risk there as well? Possibly. Again, it's not so much that Trazodone is causing heart problems. It's more like if somebody has a structural heart issue, we have to be careful with it, and we have to, and make sure the cardiologist is aware and speak to them about it. Okay. I believe the drug manual talks about the context of the usual 50 to 100 milligrams, but I can't really know without reading the scientific research behind them. Yeah, I'm not sure it's a dose-dependent issue when we talk about the heart specifically, Pulowski, but if you're concerned about that and you do have cardiac issues, you definitely want to talk to your provider and maybe have a cardiologist take a look at your list of medications and make sure you're okay with that. All right? Let's see. So there were a couple of questions about melatonin. Angela asked about sublingual melatonin, which I wrote back with a typed out response, but I'll also say it here as well. Yeah, sublingual melatonin is fine. I don't really care about what kind it is, right? It's more the dosage and what we're using it for. So whether it be sublingual, whether it be a pill, a gummy, doesn't matter. Okay, it matters the dosage, what kind it is, as far as is it immediate release versus time release, and when we're taking it. Okay, and I've talked about that before. And do you prescribe melatonin relative to the target bedtime or to the current bedtime of your patient? Again, it depends on the situation. I think you may be asking about something called delayed sleep phase, in which we may have someone take melatonin hours before they normally go to bed to try to help their brain and body get used to going to bed earlier. That's kind of out of the scope of this talk right now. But what I'll tell you is this, is if I want somebody to, let's say they're not getting to sleep till 3 o'clock in the morning, right? But, and they have insomnia, not delayed sleep phase syndrome, which, again, I'll talk about some other time. But if they just have garden variety insomnia and they can't fall asleep and they want to try only natural things, what I would do probably in that case is have them take maybe 5 milligrams of melatonin around 11:30, 12, with the idea of trying to tire them out so that by 12:30ish or so, they really start getting tired, in addition to meditation and things of that nature. Okay, so I guess in that case, what I want them to do is take it closer to the ideal bedtime, right? Now, let's say somebody has difficulty staying asleep, right? What I may do in that case is have them, I don't really prescribe melatonin because it's over the counter, but I may have them take a time release version, maybe right at bedtime, because they don't have any trouble falling asleep, but they have trouble staying asleep. Okay, so it kind of depends on the person. Okay, so these were great questions. Unfortunately, because the nature of these videos, I don't know you guys personally. I can't really comment too deeply without knowing your full history. So that's why I keep saying, both for medical legal reasons, but also for good care, you definitely have to talk to the providers who are prescribing these things to you. Okay, because they would know your history and about the whole heart question. They would be able to send you to the right people. Okay, but these are good questions. Definitely gives us some things to think about and opens up the discussion. So if you have further questions, please ask them in the comment section below. Again, these videos are for educational purposes only and to get you guys thinking about what else can we do. All right, so my book is in the Amazon description. Please click like, please subscribe, please share with your friends and family. And until next time, everybody, sleep well.